Hi there, my name's Sarah Connors and I'm a physiotherapist who's been working in elite sport for nearly 30 years now. It's difficult times that we're living in at the moment. I'm currently self-isolating, so I thought I'd use my time wisely and start doing some videos for patients on different injuries. The first one that's been requested is the pes anserinus. So the first question is, where is it? What is it? Okay, so the pes anserinus is a series of tendons that runs down the inside of the knee and inserts just onto the inside of the tibia. It can be quite a troublesome injury. I find if patients get it, it niggles on for quite a long time without the proper sort of advice and treatment. So what can we do about it? The first thing is we've got to look at is, why is it become overloaded? What's the cause of the problem? So the pes anserinus is it's a series of 3 muscles that insert into one joint tendon. I'll still remember this from my uni days. It's say grace before tea. So it's the sartorius, the gracilis and the semitendinosus tendon of the hamstring. So it's part of your adductors and part of your hamstrings that all form together to form one large sort of fibrous tendon over the inside of the knee. That's in simplified terms. So why have the medial hamstring and the adductor got tight and got overloaded? The biggest sort of question for me is, have they overworked? Probably. Why have they been doing all the work? Have they been doing a lot more stabilising work than they should have been doing? Have the glutes not been doing the work that they should have been doing for the stabilising? Is the hip tight? What's the pelvis like? You know, it's quite hard to assess lots of those things on your own. However, you know, there are a few things that you can look at. Firstly, you can check what your lower back's like. You can just try some lower back rotations where you lie on your back, bend one knee up and stretch it across to one side and then across to the other. Do they feel the same? You know, just circle your pelvis around. Does it feel the same? Does it feel stiffer on one side in your back or the other side? It's probably the sort of the first signs that something's going on a bit higher up. The second thing is the glute tight. Just have a little glute stretch, lie on your back. You can cross one knee over the other knee and pull the leg towards you. This should nicely stretch the glute, and quite often you'll find one side just feels way tighter than the other. And then is the nerve tight that supplies all the adductors. You can try a straight leg raise, put one leg in the air, pull the foot towards you. Does one foot feel tighter than the other? Have a play around and just see, you know, is your back tight? You know, it's just to see where, you know, where things are actually coming from. So that's the first stage. And then a little bit of testing. What's the glute strength like? Can you do equal numbers of one leg bridge on one side as you can on the other? So to do a glute bridge, you need to lie on your back on the floor, knees bent, slowly rock your pelvis back, engaging the glute and the abdominals, and lift up the pelvis. Can you lift one leg comfortably, or is your body shaking all over the place? Quite often, if your glute's not working, the body will be shaking and the adductors will be overworking on that side. And then a nice strength test is, can you lift up and down with the pelvis? So basically, in the glute bridge position, you put one leg in the air and you need to lift up and down. You should really be able to do 3 lots of 20 quite comfortably, especially if you're an endurance-based athlete. And quite often one side is fatigued, which again shows that's why the sort of, you know, the adductors have been overworking. So that's just a few simple things, because first of all is, why has it happened? The other option to why it's happened, looking at the cause, is what's happening at the other end of the foot. Is the foot collapsing in? What's the shoe like? Is the shoe a little bit old? Have you overworn them? You know, have you gone past the limit of its tolerance? Maybe not giving you the same support. So if your foot's just rocking in a bit more and your knee's turning in again, that will stress the tendon from the other aspect. So it's not just from above the muscle. You've got to look below. You know, why? You know, have the mechanics changed from a sort of a below aspect. So have a check of your footwear and just see what's going on there. Have you done lots more miles? been running on more camber, anything that could sort of slightly adverse, affect that, the inside of the knee. Okay, so what can you do at home? Because obviously I'm not available, can't come and see me, but how do you release the inside of the leg? Well, it's firstly, you can actually just go into the muscle bellies. So, if you sort of, put yourself into an adductor stretch position, so sitting on the floor with the legs out straight, or with the feet together, so you're in like a frog position, you can actually feel into that tissue and actually try and release it yourself. I can do a separate video demonstrating some of these things after. I probably wouldn't rub too hard at the tendon. The tendon is normally tight and inflamed because of another reason. It's normally the muscle belly is tight and overworked. So, you can do some local release onto the sort of muscle belly. However you sort of find the best way to release that muscle is, you can hold it and stretch it. You can do some trigger point. You can use a ball. It's a bit different. You can roll a bit more onto the medial hamstring, but it's a bit harder to get into the adductors. With a foam roller, you have to contort yourself a little bit. So that's your sort of self-release. Yes, you can do some normal stretching. So what I would suggest is find out why it's happened. Is something weak, something tight? Have your biomechanics altered? Looking at doing some lower back stretches, doing some lower back rotations, and some nerve stretches, lying on your back with the leg in the air, pulling the foot towards you. It's always quite a nice one. Repeat this 3 lots of 10, moving the foot all the time. We don't hold a nerve stretch. Then you can do a little bit of self-release into that muscle just to see, okay, what's going on? Can I release it? Take the release a little bit further into the calf. Make sure there's no tightness coming from down there as well. And then do some strengthening work. Make sure your core is doing the work that the adductors shouldn't be doing. Basically, making sure your stabilising muscles are working correctly. So that's a little bit of a summary for the pes anserinus muscles and a bit of tendinopathy around that area. So any questions, feel free to ask away, and we'll sort of see what feedback we can give. That's great. Bye.